2015 was really the year for clarification for the role of docetaxel chemotherapy in the disease, in prostate cancer. I mean, until this year or the year before, let's say, for the last decade, docetaxel chemo was used only for patients with very advanced disease who had already exhausted basically all what we had in terms of hormonal therapy for their metastatic disease. And chemo was not even used outside metastatic disease. Now, in the last year, we had much more clarity as to whether we should use the very same treatment earlier on in the disease to get even better efficacy. And for example, for patients, and I'm talking about approximately probably 10% of the overall newly diagnosed patients with prostate cancer, patients with metastatic disease, when they are diagnosed with their cancer, should probably now get docetaxel immediately on top of their classical hormonal therapy. We have now 3 randomized trials supporting what I'm saying, 2 of them showing overall survival benefit, and the third showing also a trend, and the 3 trials are showing progression-free survival benefit. So quite clear. And here at this meeting at ECHO, we had a meta-analysis on these 3 trials, clearly pointing to a good direction for overall survival. So I guess most of us, even not all, are saying now that docetaxel should be the new standard of care on top of androgen deprivation therapy for this M1 situation. Now, on top of that, there are also some new data indicating that in the next probably 5 years or so, we might even use chemotherapy in localized disease in patients who are at high risk for metastasis, although they are treated locally or even with hormonal therapy, but who are really at true risk of developing metastatic disease in 5 or 10 years from now. We do have 3 trials supporting a benefit of early chemotherapy in terms of progression-free survival, and these 3 trials are immature at the moment for overall survival. So we keep following these 3 trials, and more is to come soon. And I bet that we will have a better idea in maybe 3, 5, 6 years from now as to whether docetaxel chemo should also be a standard of care in localized disease.